are live on Tuesday Tips, and I'm here with Willy. Thank you so much. I'm Dr. Vidal. We are live on Tuesday Tips from Pure Plastic Surgery in Miami. And we are closing our month discussion doing provider as patient. This has been 4 weeks of going over different experiences. It started with me and talking a little bit about my experience as a plastic surgery patient, what I learned, what it changed in my discussion with patients. Then I had a Miami makeover with it, which was a breast lift, implants, and lipo. Then we had Sarah. Sarah had a BBL, and then she had a breast augmentation. So we talked a little bit about those two. Then we had Ashley that we talked about tummy tuck with fat transfer to the hips. And now we have our male version of the provider as patient. ¿Cómo te sientes? How are you feeling?
Excited, happy, and more than happy with my results. But I have to be very honest, guys. We are not as women. We're not as strong as women. For real.
Yes. Let's start by telling them a little bit about what procedure you got done.
Okay, on October 2023.
Okay.
Yes.
A year and a half ago?
A year and a half ago, I got the Total Definer package with Dr. Alex Earl. And what's the Total Definer?
What is it?
Okay, it was like an HD lipo of my torso, my back, my arms, biceps, triceps. I got fat transfer to my biceps and triceps, and I think a little bit on the chest too. I'm quite not sure.
Yes.
But also I got lipo on my whole torso and back. My lower back.
Yes. And Willy has always been a very active person, healthy. He works out, he eats well. So why did you decide to have this surgery, right? Because a lot of people are always like, oh, you look good. Why do plastic surgery? Why go through all of that? Like, what was your thought process? Why did you decide to go through this procedure?
Well, to be honest, as a community manager here, I can see all the results that you guys deliver to our patients, Dr. Earls, Dr. Vidal's, Dr. Wigriff. And the first thing I thought was innovation, safety, that I'm in the best hands.
Yes.
I work here.
Yeah,
why I won't try it?
Yeah,
I have to try it.
Yes.
Also, for the people doesn't know, I'm also an actor. I work on social media, not only in Pure, also on my own networks.
Yeah.
And I want to look my best.
The best.
The best.
Yes.
And there were certain areas on my body that I wasn't able to achieve. That could look like marble.
And I was gonna mention, right? Because
sculpture.
Like when he started getting the procedure done, I mean, he's fit. Right? He has a good definition of the muscles. But this surgery brought up that, like, it boomed the definition of his muscles, the chest, the abdomen. He looks like Roman, like a Roman.
I'm blush.
So tell us a little bit about the recovery. What was the hardest part of your recovery? Knowing all of the recovery, and he does our lives. So he has heard us talk about the recovery, the fajas, the foams, all of it, thousands of times. Not just me, Dr. Earl, Dr. Wigriff, every provider. What was the surprise? What was the surprise for you? Or what took you, what was a little different than you expected?
Okay. I'm thinking because I want to be as honest as possible.
Yeah.
The ride home.
The ride home.
The ride home. Nobody told me about the ride going home.
Okay. What was your experience there?
Okay, you're still waking up. I'm not as fluent in English at that time as I'm now.
This is the funniest.
Yes, and I wake up speaking fluent English, like fluent English.
And
the anesthesia.
The nurses were talking to him in Spanish, like, Willy, tranquilo, and he was answering in English. Full sentences.
Better than I'm talking right now.
Yeah.
But no, the ride home was a thing, like, if you can assure like the person who's driving you goes really slow, like really slow, like
Yeah.
20 miles per hour, and also in a comfortable car.
Yeah.
Please don't ask your husband or your wife to come in a Corvette or a Camaro or like a really low car. I'm telling you about my experience. Like a two seats Mercedes like
Yeah.
this. No, somebody like in a van.
Space.
Like,
You need space so you're
yes.
comfortable. Yeah. And this is something that I talk to patients that we get a lot of patients from out of town, but also from all over Florida. And I have a lot of patients that are like, oh, I live in Boca, I live in Fort Lauderdale. Can I just get the procedure and go back home the same day? You know, it's better if you stay close to the facility for at least the first 24 hours. You know, that drive back home after general anesthesia, the procedure done, may be a little uncomfortable. Traffic in South Florida is crazy. So, like Fort Lauderdale, that can be 30, 40 minutes from us. In a Friday afternoon, it's not going to be that. It's going to be
2 hours.
It can be 2 hours. So I always advise for patients that are not literally like close to us to stay one night, to get a hotel nearby, stay one night, and then like the next day you feel like a completely different person.
Yes, I was going to
Yeah.
say that the pain level, it's not like you're 100% of pain level
Yeah.
and the day after you're gonna be 99%. No, the difference between day 1 and day 2, it's awesome.
Night and day,
So
yeah.
yes, night and, if you can stay closer to our
Yeah.
clinic, to our office, and then next day travel back home, I think.
I think that's the best
Yes.
as well. Yeah. Of course, if you are more than 2 hours away, I do recommend you stay here for the full 5 days. I see you post on day 5 and you go back home. But for the people that are a little bit in between, that it's not very close, but it's less than 2 hour drive, then at least 24 hours so you recover and then you can drive safely home the next day. Okay. Tell me about the drains. Everybody talks about the drains. How do you feel about the drains?
Oh my god, I hate them.
Everybody hates them.
I have to be honest. There's no pain with the drains. There's just this weird sensation that you have something inside that comes outside and you're like hanging this thing
Yeah.
with blood and fluids. It's just,
But it's so much better to have that fluid drain through
Yes,
there
of
than
course.
have a soroba.
I remember that I squeezed that little bulb. How we say
Yeah,
that?
yeah, the bulb.
The bulb. I squeeze it, I don't know, like every hour. And it helped me a lot. Also,
Yeah.
the massages. I did 40 massages.
Yeah.
40.
That's amazing.
Not the 21. 40 because I listen, our doctor say you need 21 massages after a lipo.
Yeah.
And I did 40.
Very good, very good.
Also, I
and
have a special
how did you
discount
feel?
as an
Yeah.
employee, so I know.
It's not that he knows bestie Jenny.
She went to my house.
Yeah.
She's amazing. And
She's
the
great.
amount of fluid that came out of the little holes in
Yeah.
my body, wow.
And how was it painful? How do you feel with the massages?
No, nothing at all.
I mean,
As I-
a lot of people are scared about the massages.
Nothing.
So.
No. Pain only the ride back home. I have
Okay.
to be honest. That 2 first hours between I wake up and I went home,
Yeah.
I was very confused. Also confused.
Mhm.
Yeah. Even
Yeah.
if I think maybe I wasn't in so much pain, just confused.
Yeah. I mean, that's definitely helpful for people that are traveling a little bit farther away. So take into consideration. In terms of working out, because you work out a lot, how do you feel after 6 weeks going back to the gym? How was it for you?
It was easy.
Yeah.
Because I take a lot of care of everything, the massages, the compression,
Yeah.
my fajas. Then I keep doing like self massaging.
Uh-huh.
I'm still doing it.
Yeah.
Like my self massages.
Yeah.
And then for the workout, I start easy. Like let's start
Yeah.
the first day or the first week. I was just like warming up all my
Mhm.
body,
Yeah.
step by step.
And listening to your body, right? Like,
Yes, you will know how much you can do
Yeah.
and what you can.
Yeah.
I get busy the first 2 or 3 days, like really easy. And I remember something. I had a lot of underarm lipo and also some gynecomastia. Gynecomastia.
Gynecomastia.
Gynecomastia.
Yeah.
So this area was very sensitive for me when I came back to the gym.
Yeah.
and I wasn't able to put my arms up. This took 2 more months,
Okay.
almost 2 months,
Yeah.
until I have this.
But it went back to normal.
Yes,
Correct.
it's perfect,
Yeah.
and I
Yeah.
have like my whole sensation.
Yeah.
There's no like numb parts.
Yeah.
Nothing.
Yeah,
I'm-
yeah.
I'm
So it's
100%.
also it's always a concern when patients are like, I'm back to gym and I feel I don't have the same strength, or I can't reach all the way up, or I feel very tingly, or I get swollen after the first exercise.
Yes, all that happens.
Yeah, all of that, but you will go back to normal. You will get back to baseline, right?
And for real, you won't see like the real results until 6 months.
Yeah.
Yeah, and I have to be honest. When I turned the year, was when I say, "Oh, wow!" Of course, I keep
Building up.
Yes,
correct.
I keep
Yeah, I was gonna mention
eating
that.
healthy, training, and taking care and doing the massages.
Yeah.
Also, I bought una maquinita que me hace masaje.
A little machine that does the massages for him. You see all those tricks, those tricks. And how was using, so majority or all of my male patients struggle with the faja. How was your experience with the compression?
No, it was fine.
Yeah.
I'm a very good patient.
Very good.
I did anything I had to do. I followed Dr. Earl's recommendation, your
Yeah.
recommendations, everything I heard or everything I post on social media.
Yeah.
I tried to use it.
Yeah, and it wasn't-
pineapple juice, for example. My mom does or did my pineapple juice like from real pineapple.
yeah,
and
fresh.
Then, yes, and the tea.
The
This
tea. Tell them about the tea.
Yes, with a
The leaf.
concession. La conchation. How we
The-
say
yeah.
the outside of the pineapple, the cáscara. Help us. How you say the outside part of the
La
pineapple?
cáscara del pineapple.
Ay.
The outer part. The outer part.
Okay. My mom boil it, and then with a little bit of Splenda, I have it as a tea.
Yeah.
I
I did the same thing in my recovery. My mom did the same thing. And it was very good.
the bromelain, right?
Mm-hmm.
And also I did arnica under my
The shell.
the shell. It's easy. I did arnica little pepitas
Yeah.
under my thumb.
Mm-hmm. Yep. Awesome.
Yeah.
Okay.
What else can I tell you?
What else?
The recovery part, it's just listen
When
to
did
your
you
body.
come back to work?
In a week.
1 week.
One
so yeah.
week.
Okay. Yeah.
But for those days, I started coming just
For a little bit.
because
So
I came for the massages and
Uh-huh.
also did a few things from
the
here,
office.
and then I keep working from bed. Remember, my work allows me to work
Yeah.
from bed. Don't be jealous, but I can do
Cheater.
it. Not every day, but I can do some
I
stuff.
definitely can't work from my
And
bed.
the second week, I was back.
Okay.
Let's say when they took the drainages,
Everybody says when they take the drain, you feel like another person.
I started like my full
Yeah.
thing back. Yes, and it's not. I insist it's not painful.
Yeah.
It's just something weird hanging there, and the removal. I was very stressful.
Yeah.
About the removal.
Did it hurt?
I didn't feel anything.
No.
When Sarah removed my drains, she told me count 1, 2, 3, and I started 1, 1.5, and then she was like,
It's out.
Really, it's out, and I was, but out, like for real? Yes, for real.
It's out.
I don't know if we have questions, but I don't
Yeah.
have my.
Let's see. Oh, the pineapple tea is one I'm gonna have to try next time. Yes, the pineapple, like if you take the shell out, like use the inside for the juice, like fresh juice, and the outside just boil it. And that water, then just a little bit of Splenda, a little bit of sugar if you want to give it some taste. And it's actually good. And that has the highest content of bromelain, so it's very good. I used it too in my post-op, and I think it helped a lot.
Okay.
Is there a way to directly talk consult with Dr. Vidal? Of course. So the best way is reaching through your coordinator. And if you're a new patient, I see that you are rescheduling. Your coordinator is the person, your contact person to help you all of this. But yes, scheduling a virtual or an in-person is always a possibility. And then she's gonna help you kind of schedule it with my the dates and times that I'm available. Okay.
Let's see. Viste, yo siempre te hago eso.
Awesome.
I'm the one who knows
And I'm working today.
Yeah, press the
Wait.
question mark there.
This one?
No, to the right.
This one.
Uh-huh.
Okay.
No questions.
Okay.
Okay.
Awesome.
Whoa.
Awesome.
Okay, Fiercely Fit Mama. Hey Maria! My friend!
Since Willy does my lives and he's usually on the other side, today we're both on selfie mode. So that's why we're like going through the questions. So, I think that it's always so different to go through the experience, even though he heard it thousands of times before. I say it a bunch of times, but going through it and experiencing like firsthand is always different. So that's why I wanted to do like this series. And having Willy with me here, it gives a different perspective because I do have male patients. Plastic surgery, the majority of the patients are female, but I'm seeing a trend, and I encourage that trend. We are all empowered to take the decision. Like if you feel uncomfortable with your body, doesn't matter if you're female or male, you can get a consultation and seek plastic surgery. So, and I have a lot of male patients. I have one this week actually.
And also we posted a before and after a few days ago.
Yes.
And somebody reached out to us today.
Okay.
Today and book the surgery.
The surgery. So yes, male patients are always welcomed, and sometimes we don't talk about it enough. So I wanted to bring Willy so you have the male perspective and show you his experience. So
I think this will be just one of many times I'll be under this amazing surgeon.
yes.
Someday, I hope.
Oh, wait, you didn't mention. Yes, he had cyst removal
By Dr. Vidal.
by me. Yes. So yeah, unfortunately he had cystic acne, which was causing a recurrent cyst popping in his face. He had an infection a couple times. Had to have it drained, so we removed it, and you look beautiful.
Thank you.
And
Now
not
it's
with
like
it.
an IPL treatment, so now we're gonna clear the scar.
The scar, so
At
it goes
simple.
away. Yes. So thank you so much, you guys. I know there were some questions in the stories. I'll answer them in the stories as well because the selfie mode is not letting me see the questions. But I'll definitely answer them in the stories. And if you have more questions, just jump in the stories or DM me. I'll be seeing you guys next week on Tuesday Tips.
Can I say one last thing?
Just one.
We have a new promo with Dr. Wigrief.
Oh yes.
Yes.
Yeah.
He has a special day with consultations.
Yes,
So
he has an opening in his schedule and he's doing free consults. So take advantage of that. Give us a call. Okay.
Thank you.
Bye bye.